My name is Brad Talbot. This is my presentation for alternative therapies for gastrointestinal issues for the Care Management 2. I chose to center all my alternative and complementary therapies for one issue, Heliobacter pylori, otherwise known as H. pylori. It's the most common infection in the stomach in the world. In fact, 2 out of 3 people in the world have it. 40% of Americans have it. Many have it are not aware because only 20% show symptoms. Amongst the people who do have this infection in their stomach, a lot of them are in the ethnicity within America of African American or Hispanics. It's able to withstand the acidic environment of our stomach because it produces the ammonia and it counteracts the acid. It survives off the mucosal outer layer within our stomach where it irritates the lining and has our stomach produce more stomach acid, which can cause the ulcers, which is why this is the most common cause of peptic ulcers. Typically, standard treatment for the H. pylori include a regimen of a mixture of at least about 2 antibiotics or more with a proton pump inhibitor to counteract with the irritation to produce more stomach acid. First, complementary therapy is plants and spices to help treat H. pylori. Garlic was shown to have an association with less rates of gastric cancer, so when they did some studies, they found it, along with broccoli, have in vitro antibacterial effects. That basically means in a test tube or a petri dish, it seems to really harm H. pylori. However, in vivo trials, which is where you put in a living creature, either a human or a rat, it had very mixed results and wasn't very reliable versus chance. A stronger evidence supports the use of green tea and curcumin. So green tea prevents the H. pylori from creating that ammonia with inhibiting its urease enzyme from hydrolyzing it, making it more susceptible to the acid. It also has some anti-inflammatory effects. Curcumin also has been shown when you have 2 trials, one group of people getting the trifecta treatment, and the other group of people getting both the trifecta treatment and the curcumin, that the curcumin showed better outcomes, less symptoms, and more of the H. pylori being cleared up. Interestingly enough, H. pylori require an environment between 5 and 15% oxygen, not too much, not too little. And our stomach has around 15% oxygen. And they found that the organic compound porphyrins, which I suppose all aerobic respirating life forms use, is photosensitive and can be turned off when the presence of light. So if you stick a light in their stomach, there's multiple ways of doing that, you can actually suffocate them in a way and they die. You can kill them with light. Right here is in the shop top right here is an endoscopy. That one had the most rigorous results, showing up to killing 95% reduction in the main stomach. But there's also pills that are being explored as well. One downside of this, though, is that in the study where the endoscopy was used and others, the bacteria seem to grow back. So it seems to be a temporary but promising start and can be used to clear it up first in combination with antibiotics and whatnot. And the last therapy is probiotics. There is still much more to learn with this, because apparently probiotics don't just replace the bacteria in the mucosa competing for resources and prevent their biofilm from having reach, but they also suppress the urease activity, just like the green tea does, preventing H. pylori from protecting themselves from stomach acid. Some have been shown to inhibit the inflammatory factors made by H. pylori, one of which is called IL-8. And when combined with other therapies, has been shown to increase elimination rates to reduce symptoms of H. pylori, even while antibiotics are being given. You got the good bacteria. And here's all the references from the paper. right there. Okay.